Okay, everybody, I think we are live. So, hi, my name is Lynn Weems. For those of you who don't know me or have never met me yet, this is coming to you live from a different kind of better clinic in London, Ontario. And today I'm really excited because I'm going to introduce you to someone really special. So I'd like you to meet Dawn Perry. And who is Dawn Perry? Dawn Perry runs something called Retreat Spa in St. Thomas, Ontario. And Dawn is a reflexologist as well as many other things. So Dawn started off her career in nursing and then moved from nursing into holistic therapies. And she is an amazing reflexology practitioner. And as you know, I like to interview people that practice with a difference. And that's why we're called A Different Kind of Better. And Dawn definitely is a reflexologist, I believe, with a difference. And I've had one of her reflexology sessions, and I can tell you that it is the best session I've ever had in reflexology. She goes the extra mile. So today we want to talk about, does reflexology work? Like, does it really work? And when would you use it? And how would you use it? And why Dawn is different. And so we're going to get started. So hi, Dawn. I want to thank you so much for agreeing to allow me to interview with A Different Kind of Better, because I know Dawn, and I know Dawn is like me. She gets very anxious with public things, but you know what? People agree to do this because they want the world to know. They want the world to know about alternative therapies and the reason why they can help you. And it's really important to Dawn. So Dawn, we're going to get started. So let's start with the first question. Who can benefit from reflexology?
Well, everyone can benefit from reflexology. That's the nice thing about this modality. You can be anywhere from a baby who's colicky, constipated, fussy, doesn't sleep, appetite. There's so many things for babies. Then there's right to the elderly, that insomnia, pain, fibromyalgia, arthritis is a big one. And then just everyday working people. Well, my kids love it. They stick their feet in my face every day. Mommy, do my feet. So everyone can benefit from it, which is the nice thing about reflexology.
I like that you talked about the fact that you've actually worked with babies, because, a lot of our modalities, people tend to think that it's always just for adults, right? It's not for babies, it's not for seniors, those kinds of things. And addressing that, I think, is important, right? The age group. In your opinion,
safe, right? You cannot hurt a baby with it. So, and having that mom being able to show them, do this trigger point, do this spot, it really helps them that they can go, oh, and the baby, you can just see them. It's just comforting. They're just calm.
Yeah, and that would be really interesting. Having had a colicky baby, my first daughter, Christy, she was definitely colicky, and I went through, I think, about 5 months of screaming all day long. And had I known about reflexology at that point, I definitely would have looked for some help, because my Western background definitely didn't help me in that area. So you're talking a bit about the conditions that reflexology is used for, and you mentioned a few.
Yes, stress, muscle pains, fibromyalgia, arthritis, hormone imbalances, restless legs, a lot of conditions that people don't think reflexology can be used for is plantar fasciitis. I work a lot on that. Migraines, headaches, people that just can't sleep, post-operative, right? Just pain in the body in such tense response, right? getting
Yeah.
constipated from that. I've been privileged to work on people with dealing with cancer, um, just
Mhm.
helping their system calm and relax and let the body heal itself. Because there's
Mhm.
a lot of side effects that come with that, right? Your diarrhea, your constipation, nausea, vomiting, all of those things. So putting the body in a more calming state, helping the nervous system and the body is a
Yeah.
natural, it's a machine. Our bodies are so incredible what they can do. And allowing the body to go back into that healing state is just so peaceful.
Yeah, and if people don't realize how powerful our bodies are at healing it ourselves,
Mhm.
right? We tend to rely on medications, sometimes even supplements are overused, rather than using something like massage or acupressure or energy medicine, vibrational medicine, those types of things that are less invasive, right?
Absolutely.
So so you mentioned plantar fasciitis, and that's interesting to me because I know that's a very painful condition, right? And you would not think that you would be able to manipulate someone's feet, when they have that.
Right. They get a lot of relief out of it. And those people, again, I don't tell people you have to come in this day or that day. People know themselves. That's the nice thing about reflexology is you're your own health control board, right? So you know that, okay, I've come in today and in 4 weeks from now, wow, okay, I'm starting to feel that stiffen up again. So they call the office or whatever. And if they know that pattern, they can just book in every 4 weeks and they know that's when their muscles and the tendons start, creeping back up. So
Yeah.
fasciitis, it's so rewarding watching so many people walk out of the office feeling great. It's a very rewarding profession, I can tell you that.
So, Dawn, what made you pick reflexology? How did you end up doing that?
So reflexology, my great aunt Mildred used to do reflexology and grow her own herbs and gardens and everything. And so she would work on all of us as children and babies, and my mom being a registered nurse, and but always believed in natural medicine for us kids.
Mhm.
And so my mom kept saying to me years ago, you've got such a knack with your hands and in helping people. Why don't you take reflexology? I'm like, oh, mom, that's one more thing on my plate right now. I don't want to go back to school again. But you know what? I'm glad she did because I absolutely love it. It is so rewarding. And now I get to use all of my modalities. So in my treatment room, I can go from reflexology to my deep tissue to my cranial sacral to my nutrition background to a little bit of my health background and having Western medicine complement Eastern medicine so well. And that's what makes, well, living in Canada, we're privileged.
You know,
So
I
getting to use all of these wonderful modalities and, like I said, Eastern and Western medicine working together, it's a perfect marriage, and we're blessed. So, and I've been blessed in my career for sure. I get to work with really happy people, and they they walk out happy and feeling great, and that makes me happy.
Yeah, I've noticed lately that there are a lot more people that have practiced Western medicine moving into the alternative therapy arena. And that really excites me because I truly believe that having a bit of both actually helps in both areas, right?
Balance. Mhm.
Yeah, there's a definite need for that balance. And I think sometimes having that Western background allows you to sort of decipher which modality is best for that client, right? Because I'm sure a lot of people that are watching today or in the future, they're probably wondering, well, how do we pick? There are so many different modalities out there or alternative therapies. How do I know when to use reflexology? you know, um, as opposed to massage therapy? And what does reflexology actually do for the body?
You know what? That is a great question. So, doing deep tissue massage myself, I have people that are like, oh my God, reflexology is so much better than a massage. But that's for them. And we're all individual. We're all made up very differently. What works for you, Lynn, might not work for me. and what my body needs. Maybe I'm a more anxious, stressed out person. So having reflexology and going to sleep and just laying there, my body just breathing and relaxing and healing and not having a trigger is the best modality at that time for me. Whereas maybe you will go in and go, you know what? I know today though is a day that I need a massage because I need this all stripped out. I need, right?
Mhm.
So maybe osteopathy is a great thing. Maybe chiropractic, having a trigger down there is not a great thing. So the nice thing about what you're doing in alternative medicine is there's so many beautiful modalities out there with next to no side effects, which is kind of our goal in life is to heal the body internally, preventative medicine and health.
Yes.
But we need to be proactive on our health because getting a diagnosis or you seeing diabetes on the rise, cardiovascular, heart disease, um, Alzheimer's, the list goes, fibromyalgia, all of these things go on and on and on. And once these people get diagnosis of this, they're mortified. They're like, oh my gosh, right? What do I do now? So I always say, take charge of your health. Preventative medicine is huge.
Yeah.
Meet someone, meet a therapist that's right for you. And then hopefully that natural health therapist will refer you to the next person to have a good marriage happen for you and rebuild your empire, rebuild your health.
Yeah, and the other thing too is that I think is important is environment, right? Like I know that, when I came to your spa, what impressed me was how calming it is, right? The equipment that you have, the you gave me a choice of how I wanted it done. Would you like the bed? Would you like and even the warming blanket was really cool. Or would you like the chair? A lot of those kinds of things, you're very it's important to you that the client is comfortable, right?
They have to be because we're healing. The body has to be very comfortable. The average person that first comes in to meet us, they don't know me at all. They don't know what they're getting. They don't even know what's going to happen during session. So yes, we start off with a nice Epsom salt detox foot soak, and then we take you to a very private room where the lights are dim. You can have the lights on, but it's all up to the client. Again, individual. Maybe they have triggers. So we go into a room, it's private. They can choose to lay down and relax under a blanket. You're fully clothed during session. The only thing we do is have you remove your socks. And then you lay there comfortably. You can sit up. Some people that I have heart conditions. So laying on their back is not appropriate. So we have them sitting up completely. And some people choose to talk during session and get off their mind what's going on in the day, or we laugh and we giggle a lot. But that's just a me. But understand that if I first met you, I'm not going to talk, only because your body's there to heal. So I'm going to try to produce that. And I'm not being rude, or I tell clients this all the time, I'm not being rude. I'm just going to help your body go into a healing response here and to relaxation. And
Yeah.
if you want to talk, by all means, you're welcome to. So it's all on the client. We get to chat before they fill out a health history and what's going to make them most comfortable. It's not about me, it's about them and their care plan, right?
Yeah, and absolutely. Like Dawn and I have actually worked together on a patient that had a cancer at the time. And it's nice to know that, two people with totally different skills, have the opportunity to come together and augment each other's skills. And this is the whole thing about this, a different kind of better, is that we want to promote this. We want to promote that practitioners can invite other practitioners in to help them with their client, because the ultimate goal, the ultimate vision is to get that person better, right? It's not about, I'm a better practitioner than you are, or I have more to offer than you do. We have to accept that we all have skills that we bring to the table. And I can tell you that when you are chronically ill, and I'm sure you will agree with me, Dawn, you have to use every tool there is in the box.
Absolutely. Your goal is to get them to the best health condition they can possibly be in. Because let's face it, life and stress and disease process, everything weighs us down and we feel heavy. So when we can feel light and uplifted and energetic, I mean, we've done our job. And if we can continue to layer on that and make them be their very best, that's success. That's happiness for sure.
Yeah. And sometimes the end result isn't always the best, right? I mean, there are sometimes there's a higher power than us and we can't change that. However, enhancing the quality of life that they have during that time is also of huge importance, right? To, if they're at a point where there's just no saving them, it's still nice to know that we can help them
Make them
get through that.
absolutely take away as much pain and make them comfortable. Absolutely.
So, Dawn, have you ever had anybody say that reflexology hurts or?
So that's a great question too. Okay, so yes, some people have said, "Oh my God, I would never do reflexology again. It hurts so bad." Okay, it it can have tender spots. So if you have IBS or anything bowel related, and we're hitting that um, spot on the foot, that reflex of the foot, it can trigger more pain. If the client, I always check in with the client, is that too much pressure? Do you want more? Do you want less? Because it's not made to be painful. Like we're not here to hurt people at all. We want to help you, but we're not applying copious amounts of pressure. Again, with pressure, it all varies depending on the client. If they're extremely ill, if they're elderly, if they're a baby, if it's plantar fasciitis, it's probably going to hurt more. I'll be honest. I'm not going to lie about that because it does. Um, but at the end of it, I'll tell you, 10 times out of 10, they're walking out, they're going, I feel like I could go dance for days now. My feet feel so good. Construction workers, that's another. I have a lot of men as well. Everyone's like, oh, it's like only a woman thing. And that's not true. I would say I probably 70% men for reflexology.
Wow, I did
And
not know that. So that's,
absolutely. I would say 70% of my clientele are men. For feet because they're construction workers, they're working on farms, they've got health issues that they don't want to go talk to their doctor about, and they feel great after. So, I mean, it's for everyone. And again, the pain, it doesn't have to be painful. If you have ticklish feet, it can go the opposite way too. I've had a lot of people go, "Oh, I can't do that. My feet are too ticklish," and we're applying enough pressure there too that the feet they're fine.
so Dawn, how long is a session? Like,
So a session can vary. I generally do an hour. I've done half hours. I can do half hours. Generally, they're like, "Oh, can I stay an hour now?" Well, that doesn't work for my book because I'm already booked. But again, it varies. So if it's a senior, generally they want an hour, but it depends on how frequent you've already been coming in. A baby, I probably wouldn't do more than 20 minutes, max a half an hour, because a baby's not going to sit still that long.
right.
And if they do sit still that long, they're probably already asleep. So you can do your work on a foot this big pretty quick.
So is reflexology safe for everybody?
Yes, it is very safe for everybody, which is really nice. It's a modality that no side effects. The only thing is you're going to feel great and wonderful and refreshed and elated. Like just, oh my gosh, how did I not know about this?
I know when I had my session with you, for example, it's the first time I've actually, because I've had massage and everything, right? I tend to spoil myself because my health is number one priority to me. You find when you've had a critical illness and you've had to fight for your life, you start prioritizing yourself first, right? It changes how you think, and you making self-care becomes of utmost importance. Instead of it being last on the list, it now becomes first on the list, right? Even with my paychecks, the first thing is I'm getting what I need supplement wise. It's going to make my healthy body healthy. That is my priority, right? It's, other than tithing, right? But it's, I'm guess what I'm saying is in your session, I found it was one of the first things that actually made me want to go to sleep.
Yay.
And massage, I've never had that effect with a massage. Now, maybe, and I think I have a good massage therapist. I haven't had too many massage therapists to compare them, but I loved that it is totally relaxing.
And it should be. Yes, it should be. A lot of my clients do sleep. The ones that just need to talk that day and vent or just talk about their health. Dawn, what can I eat? Dawn, what can I do? I'm kind of going through some allergy stuff right now. What can I do preventatively or whatever? Then we get to talk about those things in that hour.
Yeah.
Right. So, and you can develop a little care plan. Okay, go home and try this, try that, for anything. So
I really want to encourage people to try things, right? Because a lot of people have never tried reflexology. For some reason,
no,
a lot of people have nothing about showing their feet or, but it should be something that everybody tries. Like you need to try everything to find out which is your favorite thing.
100%. I mean, I hear it all the time still to this day. People are coming in saying, I've never heard of reflexology. I'm like, that is sad because you're missing out. It is the most wonderful treatment. I would say 99% of my clients will say, oh my God, if I was a millionaire, I'd do this every day.
Yeah.
Because it's that amazing. Like you have to try it once. That's for sure. The nice thing about it is it's getting more and more recognized, right? So there's more and more companies across Canada, insurance companies covering reflexology.
And that was my next question. I try to ask this affordability wise, is it covered by insurance, those kinds of things?
Yeah, so more insurance companies across a number of them are covering reflexology now. If you don't know if you have it or not, then you can ask your employer or look it up on your insurance policy yourself. And if they say, no, we don't have it, you can request from your employer that I would like reflexology covered, or you can call the insurance company yourself and say, is there any way I could add? Yeah. But I would recommend trying it first, because if it's a modality that you're never going to use, then no, don't get it covered. But yeah, or you can keep your receipts for the end of the year. I do give a licensed receipt.
For tax purposes and things. So do you know what kinds of ailments insurance companies would be more likely to cover? Is there a specific, treatment like so back pain or that kind of thing? Or
you know what, that's a great question. I haven't even asked my clients that have gone, because a couple of their doctors, which is, I want to say kudos to these two doctors that are in particular for me and St. Thomas, have recommended myself to their patients, and they wrote them a note for reflexology being covered. That was huge.
Okay.
So I didn't dive into that more. I guess I probably should have.
Interesting to find out, but
yeah, I should find out about that. Good question.
So now we're going to get into something else, because I have been saying that you're different, right? And that's and you're different in that you use essential oils with your reflexology. So tell me something. How do you integrate essential oil therapy into reflexology and do it safely? And what is the benefit of having that additional therapy alongside the reflexology? Am I wording that right?
Yeah. So I've been blessed to have some, there's the storm, sorry. Essential oils in my life. I have an array of essential oils. I've been blessed to make a lot of concoctions and stuff for my clients suffering with allergies, eczema, psoriasis, arthritis. So the nice thing is I do a health history with my clients prior to session. I get to know a little bit about them just talking to them prior, and if they say these are chronic things for me, I can say, well, today during session, I can use a couple of essential oils. If you're open to that, I'd like to go make a combination for you. And then I'll have them smell them because sensory is huge.
Mhm.
They might go smell that essential oil that's really good for digestion, for example, like your ginger, your peppermint, and all those. And they might smell it and go, oh, Dawn, I can't be in the room with that. So, and that's the last response we want in a treatment room. So we make sure, A, they like the essential oil that I'm going to be using, that I suggest anyways. They can suggest their own as well. And then I do a little blend up and use that at the bottom of their feet, just like the olden days people would say, put Vicks on the bottom of your feet. Um,
Yeah, not anymore.
so I would encourage other things that are petroleum based and stuff, but that's okay. I mean, I'm sure some of it worked. And or if it's a sleeping or insomnia issue or anything like that, Dawn, I'm always chronically stressed, or Dawn, my hormones are out of control, so I'll maybe use some bergamot and some other balancing lanolin and stuff like that to help with hormones that session. And they're like, oh my God, I feel so good. So the nice thing is they can go home, and if we have essential oils, but if they want to go home and do their own blend or diffuse it in their home, I never, ever, ever recommend ingesting essential oils. I do want to put that out there because I get a lot of emails and a lot of messages every day. Dawn, I was told, you know what?
I agree with you there. I
Okay.
know a lot of people would disagree with
I
us.
know, I know, but you know what? We use lemon in a lot of our cleaners, like pine sols and chemicals that people use to clean their homes. I like Enyo, but whatever. Um, they put lemon and orange and all of these in our cleaning solutions because of the turpentines and that to act as a dissolvent to eat away. If you actually put that on wood and that, it will eat it. So if we're saying to ingest this, I would say that our internal organs are a little bit more sensitive than the wood.
Absolutely.
So, stick to your fruits and vegetables, drink really healthy water, eat your nutrients, eat your fiber. Having a drop of essential oil from lemon is not going to give you the health benefits that you're thinking. If anything, it's dangerous.
Mhm.
That's my advice. That's just one person's
And
opinion.
we want to say it's a personal.
It is my personal opinion. I highly recommend not. But I mean, we're not doctors there, and I don't ever tell people I'm a doctor. I don't want to diagnose or cure or treat. I just want to help and give you the best advice. If I wouldn't do it for myself, I'm going to advise and give you my opinion on what I think you should do.
Yeah, so the best advice is to do it through infusion, or as you said.
Topically, and a lot of the topicals too should be put in a carrier oil as well.
Absolutely.
Only a
So,
few essential oils you should be putting on meat, which means directly in contact with the skin. So, and there's only a few of those, and there's only a few essential oils that babies and pregnant moms can use as well, and limited. Like there's only a few literally. So you
yeah.
have to be so careful using. They're amazing. I don't want to give essential oils a bad note. Um, they've done them in nursing homes. I've worked with a few nursing homes as well, diffusing essential oils. They're finding people's energy and alertness at mealtime and digestion and mood in the areas of TV and stuff have been amazing using essential oils. But just make sure you do your research. Pets is another one, making sure what you're diffusing at home around your pets.
Mhm.
It's such a broad scope. It's hard to talk about all in this session. I'm by far not an expert. Everything with caution, but they're
Well,
amazing.
they have to understand, because I've been in a lab where they made essential oils, and
Oh, perfect.
they are so potentized.
Yes.
Okay, it's not like taking a lemon and putting it in water, right?
Right. Yeah,
um,
they're so concentrated. You're absolutely right.
so concentrated, and bodies can only take so much. And I'm always saying to people, when you come in with 30 different supplements and you're taking them all at the same time and they're full of fillers, okay, nearly every supplement that I look at has some kind of filler in it. If we're worried about liver toxicity and building up toxins in our blood system, circulatory system, whatever, you have to balance that as well. You cannot
Absolutely.
many things at the same time. right?
Absolutely. Just because it's natural, more is not always better, or the wrong product's not always better for you, right?
Yeah, so please, if you're, thinking about doing these kinds of things, go see a practitioner that is trained and
Mhm.
has a better understanding of how these things work. I know the master herbalist that I worked with, he's made formulations all his life. Like he's just incredibly intelligent. And he only made essential oils twice. The second time his face blew up like this. And he just looked at me and he said, yeah, he's a way too potent, too powerful. Now I know there's people out there that can do it and not have any problems, but there's a lot of what I call canaries out in the world, very sensitive. And so that was another area that I wanted to talk to you about, because the one thing I noticed when I came into your environment, I didn't smell the essential oils. So, and I'm sensitive, right? So I want to make sure that people understand that you don't, your clinic doesn't smell. They're not going to have a problem. Um,
No, we don't. And I use them specifically in my treatment room, and we're talking like a few drops.
yes.
We're not talking a half a bottle, 10 drops of this. Like, we're talking minute amounts. I mean, I'm only applying it to the bottom of the feet. So we don't need 5 drops of this, 5 drops of that. We need minute amounts. Um, a lot of people, oh, more's better. And I disagree with that. I really do.
Mm-hmm.
But thank you for noticing that, because we do work hard on that, because a lot of people do have sensory overload, or they're just hyper sensitive that it'll trigger a headache. So
Yeah.
we have to be careful, because we do work with a lot of headache clients.
So Dawn, you know, today has been so informative. I hope and pray that people have learned a lot and realize the importance of practicing safe self-care. Make sure that you're always getting the right advice from somebody who's trained in that area. And I can tell you, Dawn is more than highly recommended and very well trained with a lot of certifications in lots of different areas. 2 years of nursing training, which gives her the advantage of having the anatomy and the physiology behind her practice as well. So Dawn, maybe you can just tell our viewers how they can reach you should they want to book a session with you.
The best way is to call the office for sure. Family Health Options, or Retreat Day Spa is generally where I'm at. Try not to move around too far. You can call Melody or email Retreat Day Spa as well. We do have a website, or just call 519-472-8867, and the team would be happy to help everyone.
Okay, that's awesome. So once again, thank you for being brave enough to let me interview you. And you know what? It wasn't that bad, was it?
It wasn't that bad. You're still. My heart will slow down later. I'll treat myself.
Going live is something else. So just remember, we're a different kind of better clinic. Our page is a different kind of better. Please follow our page so that you can get the benefit of seeing these interviews every Friday live at 5. We hope to bring in some amazing people in the future that you can all learn from and benefit from, hopefully. And we hope that you have a great weekend, and we hope the storm's not too bad in our area. I can hear the rumbling outside too, Dawn.
And
So,
thank you, Lynn, for having me.
oh,
And you know what? Making a difference in the world, because you truly are an amazing practitioner yourself.
thank you so
And you truly give your heart and soul to everybody. And you know what? Having something like this, no, I didn't want to do this, I'll be honest. Um, but I really believe that what you're doing is very proactive on people's preventative health. And that means the world to me, because I hear a lot every day of people coming in going, Dawn, you said this is what I had, and I didn't do anything about it. You told me to see my doctor. He's now validated. And now I'm behind the 8 ball, which I never want people to think that way. We can be proactive. We just have to do things. And with your line of work and you putting this out there for people, they can really take a proactive, really healthy approach and build their health. That's huge. So good job for you guys doing this for the public. It is a great service. And I wish you the best success.
Thank you so much. So from Don Perry, myself, Lynn Weems, and from Dr. Tom, who Live at Fives doesn't work for a busy doc, but trust me, we're wishing you all the best. Have a great weekend. Take care, everybody. Thanks for joining us
Stay
today.
healthy.
You too. Bye.
Bye.